Thank you. And now our the next speaker is Dr. Purban Ganguly. Purban Ganguly, he will speak on the loopholes and lacunae in RB management, a 5 years retrospective clinical audit. Dr. Ganguly.
Dr. Purban Ganguly is the young, energetic Aquanian. He is the assistant professor of Regional Institute of Ophthalmology, Kolkata.
Thank you, sir. I would like to thank Aquine for giving me this opportunity. Now, this is a kind of my own journey with retinoblastoma that we have seen in RIO Kolkata. When I was a PG resident doing PG MS ophthalmology under the mentorship of Professor Samantu in Bardhaman Medical College, then retinoblastoma existed in books and in papers, and we used to write answers about retinoblastoma in the answer sheets and get good marks in the examination. But when I joined RIO Kolkata as a clinical tutor in the division of orbit and oculoplasty and ocular oncology, then every week we used to get these kinds of advanced orbital retinoblastoma, at least 3 to 4 every week. And eventually these children used to die. These things, they save the vision, save the eye, save the life, did not match, because most of them used to come in this advanced stage and ultimately they used to die. These presentations of retinoblastoma, the other presentations other than leukocoria also did not match, because 90% presented at primary or secondary orbital retinoblastoma. When we thought that something needs to be done about it, because this is the tertiary referral center, and why will these children will die with parental ignorance? The parent did not give us history of when the eye started swelling up so long. Financial problem. Then referral mess. When we used to tell them go to the oncology, get a CSF done, get a blood test done, they were like, we have brought the child to you, that is more than enough. Now you do whatever you can do. And ophthalmology department did not have any kind of infrastructure to deal with this. Ignorance of the ophthalmologists ourselves also, that white pupillary reflex being treated as cataract, operated, eviscerated, then coming as primary orbital, secondary orbital retinoblastoma. And apathy from most of the corners. These children were just left to die in the eye wards, and we used to write the death certificates. So this was the statement between 2017 to 2019. 98% children were referred from elsewhere. 94% of the parents said they did not notice any kind of ocular abnormality in their child. Suddenly this swelling has happened out of some kind of divine intervention. 92% could not give proper duration of the history. 95% patients did not know that this is potentially life-threatening and the child will eventually die. 98% patients with orbital retinoblastoma had the expectation that, oh, I have brought you to a very good government hospital and you do the surgery and my child will be okay. And among the 10% of the orbital RV which were secondary orbital, the patient has undergone some kind of ocular surgery due to misdiagnosis, which has actually spread the retinoblastoma. And 90% required pediatric ICU backup, which was not there. So there were some missing links. And this is the case of a child that I would like to highlight. This child had come from an Adivasi background, and ultimately the child got DORB. We had their contact number. When we tried to contact them, we found out the truth that the child has been killed by their own parents because they could not bear the pain. So with this 90% mortality rate, we thought that something needs to be done. The first thing that we required is the intersectoral coordination between the departments. Everything is there in Medical College Kolkata. Only the problem is that one department, ophthalmology, is not linked with the pediatric oncology department and pediatrics. RB awareness among non-ophthalmological fraternity. There is no awareness among non-ophthalmologists that there is an ocular oncology which is potentially life-threatening, and in a developed world, 100% of the retinoblastoma child are surviving, and in the underdeveloped world more than 30% of these children are dying. Nutritional support. community tracking, and RB parents group support. So we came across West Bengal government has already a MOU with this Can Kids, which is a NGO organization. They provide with people to support these cancer patients, and we came across the Indian Pediatric Ocular Oncology Group, where there is a retinoblastoma study is going on throughout in the Indian subcontinent. With these two backup, we went to the Director of Health Services and Director of Medical Education, Government of West Bengal. Believe me, we had to tell them that no, you don't have to spend a single penny. You are providing with the chemotherapy free of cost, radiotherapy free of cost. We have making a MOU with this NGO who will provide people who will take care of these children, who will provide a daycare shelter for them, provide nutrition. Then we came across, with the help of this RB awareness group in every health district, 1 or 2 ophthalmologists who are interested. We have formed an RB awareness group so that they could be any white reflex, they could be catched early. Awareness among oncologists, this is a very important thing. Awareness among oncologists that chemotherapy in retinoblastoma children has to be given without tissue diagnosis. Once we send these retinoblastoma children to the oncologist, the first thing they used to say is that give me a tissue biopsy. But when you are touching this, it's like the Rakto Bij. When you are touching these children for a tissue biopsy, it is actually progressing. So that awareness is now there. They are providing chemotherapy without a tissue diagnosis. This is very important. RB patient support group. We have formed groups with the parents that no, you are not alone. There are people like you. And you believe me, it is providing wonderful result. Night shelter for the daycare chemotherapy. One of the most important cause of dropout was the chemotherapy centers are daycare, and these children are coming from very far away. So they have got no place. They used to sit in front of the footpath in the hospital, and that was the principal reason of dropping out. Regular nutritional backup. Only chemotherapy and radiation does not treat cancer. The children need to have food, and genetic tracking and counseling. The first thing, this is the awareness processions that we started on a regular basis in the hospital itself to make the other people aware that retinoblastoma exists and it is potentially killing people. Secondly, this person is our resource person, Amina Khatun. She herself is a cancer survivor. She is the one point contact person. When a retinoblastoma gets admitted, we just send him to her. He takes care of them. He tracks them at home. He provides them with nutritional support, regular follow-up of the parents, and this is providing good result. You won't believe, this is the parent support group. These mothers used to stand behind their husbands, not speaking a word, and only observing what is happening with my child. Now when the parent support group is there, when they are talking with other mothers, they are coming in front and they are making a social change. These mothers are going back to their villages and telling others that no, this kind of problem exists. See, I have gone through this. You should not go through this. You contact with Amina. Amina will do everything to you. You come to this hospital. This hospital can provide you with a proper care. So these quasi-educated, half-educated, mostly non-educated mothers are doing wonderful social change for retinoblastoma just by talking among themselves. And this is the wind of the change. You see, we bring them together. The children, they are also coming together. The older one is telling the smaller one that no, this kind of chemotherapy will give you this kind of pain, but you believe me, after that you will be like me, or your one eye has gone but the other eye is there, you can see, or your both eyes have gone but your life has not ended. These children are interacting among themselves. So this was like a slide in a presentation, the saving the life to saving the eye. Believe me, this leap is very, very difficult. We are now going in AIO Kolkata from saving the life to saving the eye. We are proceeding towards brachytherapy because early cases are now coming. Previously, the cases we used to come, it was absolutely hopeless and lost. So we have achieved this. From diagnosis to first dose of chemotherapy has come down to 2.9 days. Within 3 days, we are providing them with chemotherapy. All investigation done. Inoculation rate has come down to below 20%. We want to make it zero. And the treatment dropout rate is less than 5%. Mortality rate, which was more than 50% between 2017 to 2019, has now come down. Even with the COVID pandemic in force, has come down to less than 5%. We want to make it zero, because in advanced countries, retinoblastoma mortality is zero. So this is the change, as Roosevelt has said, that let our hope and not the hurt shape our future. You see, these children are interacting among themselves. They are feeling that life is there for them. Only apathy was there previously. And in the words of Swamiji, take up an idea, devote yourself, struggle in patience, and the sun will rise. So this is the child who is bilaterally blind, but see the smile and in her face, that she knows that she will live. So with this, I would like